talking about scaling integrating health ecosystems for Dallas County. Please help me welcome Commissioner Theresa Daniel and former Mayor of Denver, Michael Hancock.
Good morning, Dallas. We are excited to be here. We're going to have a good time this morning. You can have a good time all day long. Y'all ready for that? Public health and health in general can be an exciting topic. I am so excited to be here. As Eric mentioned, I'm Michael Hancock, former mayor of Denver. Spent 12 years as the mayor of Denver, 20 years in public service in general, and it really laid the foundation for this conversation and my work that I get to do with Blooming Health. And we'll talk a little bit about that. But I'm excited to have my co-panelist today talk about who she is. Introduce yourself.
Well, good morning and welcome to a relatively sunny day in Dallas, Texas. I'm Theresa Daniel. I'm a Dallas County Commissioner. I was first elected in 2012, so I have done this for a little bit, but my whole background has been in public policy, public administration, public health for the last 40 so years. I worked with Dallas ISD before I was here. And looking at what's going on with kids in school districts is a really good barometer, I think, for what's going on in your larger community and who you're what are you doing? What are you really doing, and what impact does that have on the people in your community? You know, we've got all these wonderful words that we've written down and that we espouse and all this kind of stuff. But in the end, what's working? And so I take my experience at Dallas ISD is that really hands-on of putting those words to action. As a county commissioner, have transported so much of that. Dallas County is the 8th or 9th largest county in the country. So what we do a few thousand times, you know, one after the other. Hopefully practice makes perfect. One of the things that becomes very apparent too, it's the people who you have around you who make a huge difference. We were very fortunate to have Dr. Philip Wong as our Director of Health and Human Services. And he brings with him not only the medical piece of it, which is a particular kind of education that prepares him for diagnostics, for assessment, for analysis. And then, okay, so what did we do and what was the impact? I see are the main attributes that he brings. If we did not have Dr. Wong during COVID, I would venture that Dallas County would have been in a much less fortunate position. Because you have to have the insight, but you have to have, you know, some of the knowledge. The books that you have read have an impact. And so those are the kind of building blocks that we use. And so without Dr. Wong, we would be in just a less fortunate position. That all being said, when I look at what's going on in Dallas County, that also means what's going on around us, what's going on in Texas, what's going on around the country, because those are the resources that you count on. And I took on, when I was first elected, to be involved in the Conference of Urban Counties so that you can learn from other people, listen to other people and see what's going on. But then also with the National Association of Counties so that I have an idea of what's going on in Cincinnati or in San Jose or in Miami. Excuse me, it'd be all those counties rather than those cities. But the point being that you keep your eyes open for what's going on in your location, but then what are some of the tools that we have to positively impact? Does that answer?
No,
any of your
absolutely
questions?
doesn't. We're going to get into all that today as well. You know, I got to just say this. I don't know if I told you, Dr. Daniel, I was born in Texas. So I'm a Texan.
Oh, where were
Uh,
you born?
I was born in Killeen at the Fort Hood base. Anybody down there?
Maine?
I have family all the way throughout Texas. So I come here all the time. And I got to tell you, when I was working with Bloomington, I said, who should be on the stage? You know, we were talking about who should be here, what kind of experience we should have. You know, your name came up in every one of those conversations. So I pulled
No,
up
I'm
because I pull up your bio and I'm reading it, and I remember calling Nima Ruhai, Dr. Ruhai, who you met and who we all met earlier this morning, and Dr. Kavita. And I said, we've got to get her. I don't care how we get her. She's got up here on the stage because you have such a diversity of experience and you attack the question, the challenges, the system of health in a way that we should attack a lot of our social challenges in our lives, right? And in a broad way. So let's lay the foundation for this.
Okay.
And this conversation you and I are going to have about the system, the
Okay.
ecosystem. You have two rules of life that you shared with me. And I said, that's it. Listen, we got this audience here, and we've got half of Texas tuning in on Zoom.
Right. I do. Before I do that,
Yeah.
I would like to say that I came to Texas as a VISTA volunteer, and many of you may not even
Yes.
remember what VISTA was, but I ended up in Rio Grande City, Texas, which is one of those towns on, you know, Texas comes like this, and it's the very, very bottom one on the Mexican border. So we had lunch in Mexico because you just had to walk across.
Yeah.
But the point of that being with Texas Rural Legal Aid, it was a way of looking at things so that you identified where are we, what are the issues that we're facing, what are the resources that we have to address them, and let's do it. Try it out. We're not going to be successful 100% of the time, but you know what? If you don't try, I can guarantee you what that success rate is. So the point of it being is you start, and through those lessons of being on the Mexican border, is Texas is at very least a bilingual, if not, you know, my district has, you know, a huge swatch of Asian also.
Right.
So it's a multicultural, which means the richness, the gifts that everybody brings makes what I'm looking at a very rich tapestry. And I'm pleased to, but then every step along the way added another piece to, you know, to language, to culture, to things about barriers, transportation.
So that's the first rule. So the first rule you say is
We do nothing by ourselves.
we do nothing by ourselves. Y'all better write this stuff down. We do nothing. And let's park for a minute there, and we'll come back to the second one in just a
Okay.
moment. Nothing by yourself, which means you can't address. I used to say when I was mayor, if you want to know where the most challenged people live, show me where there's the least number of options for transportation.
Mhm.
Okay, where they are basically locked in a location. So you can't have access to good health care without access to transportation.
Right.
You can't have you can't address the issue of housing without good transportation, right? And you can't have transportation without good jobs or access to good jobs, so on and so forth. So talk about what that means to you when you say we can't do it alone.
If
We
you
do nothing alone is what you said.
I didn't. I was going to bring a map of Dallas County because you can see my district looks like it's geographically the smallest. But what that means is there's more people there because obviously we are divided equally, but it's by population. So that if you look at my district, all you see are the little streets where people are living, residences. Just due to the history of Dallas County and the city of Dallas too, there is a huge piece of my district that has limited healthcare, has limited, they're working on education. Childcare is a huge issue. But so it's just this block where there's a lot of houses, but I don't see the resources that you need in order to, get your kids immunizations and, just a whole variety of things. This is not rocket science for anybody in this room. You know this, you live this. But the point of it is seeing, okay, what can we learn from where we are to what's going on around us, and what are the resources that we can then apply to the people where we live, where you live. Does this make sense?
It does make sense. Dr. Ruhai, one of the co-founders of Blooming Health, shared early that Blooming Health grew out of COVID and really wanted to make sure health systems work for everyone. And so this Blooming Health platform is about bringing all the resources that one might need to help address chronic illness, as we learned from Michelle Alito while on stage, or Dr. Kavitha talks about, making sure that we can make sure if you need transportation, you get transportation. If you need to make sure you have regular meals, the system is built to help you get regular meals. What did you find when you became county commissioner in 2012 about the Dallas system that made you lean into transportation, made you lean into IT systems?
Because we were right on the cusp of so many of those things being set into place. We're a part of the North Central Texas Council of Governments, and I happened to come, Michael Morris and I came on at the same time.
Okay.
So we've really grown a lot as far as identifying those resources and what do we do? How do we act? How does the COG act? What does the cities? There are 26 cities in Dallas County. How do they fit in? And then what does Dallas County do? Which was, one of my primary responsibilities. But it's that continual asking of questions, getting answers, applying those answers, and then moving on. And how do you incorporate that into the whole? Make sense?
No, absolutely, it makes sense. They addressed in the previous panel the challenge around youth, and it made me think. I came to Blooming Health because of my mother passed away 3 years ago, April 1st, 2023. And I remember as siblings, we all took time from our jobs and to get her to doctor's appointments, to maybe go shop. I'm the mayor of Denver, which is a strong mayor form of government. And I'm literally taking time from work to go and get my mother and take her to the hospital, to her doctor. Or I'm going to go pick up, groceries for her. So she had what she needed.
But that's touching it.
Yeah, it is.
Really touching it.
And then she
No.
Yeah, no, absolutely. That's it. The thing is these personal experiences, and we hear them all the time about people saying, yeah, we learned about this one, but we didn't know about this. We learned about this service, but we didn't know about this. And so it's so kind of, I hate to use the word discombobulated, but it's kind of all over the place, almost like
There's a lot of balls in the air,
Yeah.
they doubt. But the point of it being, the more that we communicate, the more we talk, the more we have sessions like this, the more we share, the more I learn about what's going on with you in where you are. Then you tuck it in the back of your head and you go, I'm going to take a look and see what my county, what my location has regarding, you talk about kids. Obviously, that's ground zero. And so you only build up from there. I started off in gerontology. Maybe I started off in the wrong area. But the point of it being is it's still the same questions. Where are we? What are the issues? What are the resources we have? And I know that you read as much as I read, which is what is going on in St. Paul, Minneapolis right now. And so you take that and say, okay, what can I learn from that? What can I apply to my people so that they're better off than yesterday?
So to close up the first rule, we do nothing alone. To summarize it, what's your message to those who are watching on Zoom in this audience in terms of how we work to connect systems and make them work?
Well, you look around, who's at that table when you're having those conversations, and making sure that you have touched. But then that's also, you've done your homework. And you've always been doing your homework, which is getting out there and listening. Last night I was at a community meeting, and I don't talk a lot usually. But what you're doing is you're listening to the various slices out there and the impact on that exact group of people. But then also, what is the larger impact? Where does that leave us? Where does that put us? Where does that position us so that we're able to take the next step?
Yeah.
Maybe?
Yep. No, that's very good. Let's talk about rule number 2.
Rule number 2 is very easy. We are not done yet.
We are not done yet. Y'all write that down? We are not done yet.
You know,
What? Tell us more about we're not done yet.
emphatically, it's because, we're mid-process. We do our homework, we read, we talk to people, we get out there. And I'm, really proud of hearing you because that's what it is. You got to touch it. And it's because that makes it yours, that makes it real to you so that you can use that and go, oh, I learned this from Denver. And that's why I'm part of NACO, the National Association of Counties, is because you listen to people's stories. Excuse me, stories may not be the exact
No.
histories but you
Experiences.
listen to them talk.
Yeah.
What are they really doing? And what is the impact? Where are the success stories? You also learn from those things that did not go as well as you thought. And making sure that because those are lesson teachers also.
Yeah.
And all of us have them. But it's trying to keep up on that in your head to go, how am I here? And what are the tools that I have that can make all of our lives just a little bit better?
I shall have this put up on the in the last segment where we talked about the systems and how no one does this alone, right? Let's put up your diagram that you shared with us and that you created
That's
in
right.
terms to help you more efficiently and more comprehensively deliver services to your constituents in the Dallas County area. I think we have that. Do we have it? This is live television, folks. But talk about it, and then we get it popped up on we get it popped up. Yeah.
But it's really, my background is in analytical stuff. And I think that held me in good stead because it shows you the research model. I did research for way too many, no, for a lot of years. But once again, what did you learn from this? You identify what is the problem. You name the problem. Then you go, okay, what are our resources? What have other people done with this problem? And then you look at your options, and then you say, okay, option number 3 applies most closely to where we are in Dallas County, for example. But it's just that problem solving model that I'm sure you've done it dozens of times. But it's very simple, relatively, except in the devil's in the details, of course, because you really have to figure out what have I learned? How does that apply then to my particular situation? But that means that you have to know your situation. You get out there and you talk to people, listen to people. And I listen to my cities a lot because, they're the ones that are boots on the ground of transportation, of healthcare, of juvenile services, of senior services, of mental health. A couple of the things that I have becoming more and more aware is that in the 13, 14 years that I've been in office, one of the things that has really come up in American society has been the role of mental health. We've had physical health, obviously, for, years and years and years, doctors doing all that they do to keep us healthy. But it's only been relatively recently that connection between physical health and mental health has really been heightened and explored and researched to see, if you're having issues with anxiety, I'm almost willing to bet that you've got some physical problems going on too, because there's a connection there. And so it's been, every once in a while I go, oh, I didn't realize that. And part of it is the changes that have happened in a relatively short period of time and where we find ourselves now.
What's the recommendation for the people of Texas and because they're watching from all over the state, and in particular Dallas County, if you have a situation with a loved one who is in need of a comprehensive approach to health, whether you have a child on the spectrum or an aging parent who you love greatly and want to see get the best care, but you don't have a lot of resources, where do they go?
That can take a lot of ways. Chances are decent that you are talking with other people, whether it's your family, your kids. Boy, I don't feel so good. And you talk to your daughter and she goes, well, Mom, when's the last time you went to your doctor? Making sure that you do have health care that is readily available if you cannot afford particular kind of health care. I'm very pleased that in the United States, we have taken very seriously the affordability aspect of not only healthcare, but of housing, of transportation, of childcare. Boy, do not forget childcare in there too, because we're families. And how do you function? As I said, this is all you guys, you know all this stuff. So I don't think that I'm going to say any huge surprises, but we do want to pay attention. And that's where things that I do make a difference. And that's when I'm going out into community groups, what am I talking about? It's really highlighting some of these things so that people realize that they're not by themselves. We do nothing by ourselves. And that you don't have to feel alone.
Said. Well said. Well said. We have about 2 minutes left, and this wasn't planned, but you got the county commissioner who's really one of the best connectors of this whole system up on stage here in Dallas, Dallas County, 26 cities.
26 cities.
26 cities. And so I'm gonna just open it up for a question and answer, and maybe we have some questions from online as well. Anyone have a question for the county commissioner? Well, for me, I'll tell you where I got my boots. Go ahead. Sir? Wait, we got a microphone because we got folks online. We want to make sure they hear you.
When you started identifying the needs in Dallas County, what were some of the top barriers that you dealt with at first to kind of push through, right? It's a lot of barriers with things that just.
Yeah, we've already talked a little bit about that. And once again, there are no surprises. I mean, your community. And, you start off with the big chunks of transportation, healthcare. But then I also look in particular at kids. How are kids faring? What's going on with the school districts? But then also older folks. How are we treating vulnerable people in our community? And it's young folks as well as old folks, as well as those with disabilities, both physical and mental. So you just, because you could sit down, you could take out today's newspaper, and I'll bet that you would find 4 articles in your newspaper on the front page that are talking about the variety of things that are uppermost where you are. But I cannot stress enough that it's what you bring to the table. It's your insights, it's your experiences that then recognize what's going on and make those assessments of, okay, these are the 4 areas that appear to be most prevalent. What are some of the options I have? So you take a survey, you look outside of your area, you look at your state, you look across the country, and just see, where those high points are coming. Then you determine what fits better for us. And that may be financially, what can you afford? How do you what vehicles you have to get information out? Like I said, I've got this very large portion in my district. It's got a lot of residents. It's got a lot of housing. And not a lot of locations or space for even restaurants, much less getting services.
I should ask you, tell me, who are you with? Thank you for your service out there. We have a question right here. We have a question right here. Please tell us your name and tell us who you're with.
Yes, with Southwest Cares. I'm just curious.
Southwest
Cares Foundation.
okay.
It's a nonprofit
Yeah.
organization. You say we do nothing by ourselves, and that's an interesting thought. But there are a lot of gaps in services out here. So I'm just trying to figure out how Dallas County is going to help the little small entities help fill them.
Reach out. You reach out. I make it a point to know my district. And so I go to where I need to go. And if someone's having an issue, I want to hear about it. Because if I don't know about it, I can tell you that I'm not going to make any changes for that.
I guess I'm going a little bit further just in
Okay.
terms of those gaps in terms of funding opportunities and
Okay.
also contractual opportunities for the small. entities
Interesting point.
to take part.
Right. Because we do live in, I say we live in interesting times. And people go, yeah, I understand that much. And that's is you're looking at what's going on with the federal government. You're looking, right. And to me, as a county that provides a lot of service, I am not real thrilled with what I'm seeing because it is not giving merit to the kinds of things that county government does, which is providing some of those services or connecting up some of those services. The state government, what's going on there? And once again, it's just kind of interesting. You go, it, I don't feel a lot of love coming from there. So what you do is you look around your own self because you say, okay, that means it's got to come from here. I would like to take just a little asterisk up here. There is voting going on in the state of Texas right now. And please take a look at those people who are making those
It's a
decisions.
health issue as well, a health opportunity.
Absolutely.
It certainly
And
is.
so I've already voted. I don't have my
All
sticker
right,
on,
all right.
but the point of it being is there are options on that. So what do they say? Your vote is your voice. So please, that's where it starts. Let's get people who you can talk with, people who are saying what you think is important for the people that we're working with.
Dr. Daniel, I think we have one last question.
Yeah, I actually work with Jessica. So my name is Dr. Heather Kitzman. I'm with Parkland Health. I'm the Chief Research Officer there. And I'm kind of want to piggyback on what Jessica's saying. We've worked together for a long time. A lot of the stuff that we're talking about today works if you have insurance. And
Right.
Texas is a non-Medicaid expanded state.
Right.
And close to 1 out of 5, 1 out of 4, depending what geographic area you're in, do not have insurance. So transportation, all of these things that we're talking about are not options for them. And a lot of the grassroots work that we do is to really work with our most at need individuals. And those folks end up in our ERs because that's the only way they can get care. And then our county tax dollars are paying for that. Figuring out more proactive ways to deal with this 20 to 25% of our population.
Right.
Those are the things that we're trying to do with very limited funding and very limited connection with county commissioners, really anybody who's making those kind of decisions. There's a huge silo that I think we feel on the ground.
But you know, the second item the second change that I have seen since like 2012 has been the number of Parkland clinics throughout Dallas County.
Yeah, they're great, but
And
there's a
so,
long way to
and
go.
I know that they don't provide all services. I get that, but for that initial contact on heart disease, on
Yeah.
immunizations for kids, on what are some of the basic
And those are
healthcare
great services,
needs.
but people have to actually get to them. And a lot of people don't know they exist, or there's a very long wait list. Staying up in our ERs. So there's a lot that we can do to make it a little easier.
Yeah, I would say though that from what I see, it's a glass half full. We're not done yet by a long shot. I appreciate what you're saying there. But when I see the changes that have happened in relatively a short period of time, Dr. Cerise came about the same time I did too. And what he has done to Parkland to
Parkland
increase
is amazing.
the access that everybody throughout Dallas County has to the basic Parkland services.
Yeah.
And Parkland itself has changed quite a bit. What does it do at the main campus? And really, diving deep into providing those needed services for our people.
I'm thinking pre-Parkland. So if we could get some help getting people to Parkland, that's one of the issues that we have.
Right. That's where now that we have, I think it's 11 different satellite
COBC.
clinics, that's increased your chances of, you can see, you'll be able to see somebody. And if they cannot provide the exact service that you need, they can hook you up to get you to either Main Parkland, or maybe there's another one of the clinics that does have the service that you need.
Let me close on this because we're going to keep on stay on schedule here at the summit. This is the perfect reason why we're here. Okay, we're good. Perfect reason why we are here. And I saw the perfect reason why we're here is because partners like Blooming Health does exactly what you're talking about. As an outsider listening to this conversation, first questions I would ask: when's the last time we've done a needs assessment in Dallas County? When's the last time we've done an asset assessment, a mapping of Dallas County? What are our needs? That becomes our plan to push to our public servants and to electrify the voting base. We need folks who reflect that the most underserved, most challenged side of our community needs these services. People are hurting. And if you are having to wait for an emergency to get into get health care, we're going to be in a lot of trouble. That leads to chronic health issues, spread of disease that we could avoid, that are quite frankly avoidable today. And quite frankly, we lose a lot of our aging population. We'll lose a lot of our children, or at least they'll become or develop chronic health issues. So these are things that we have to address. And one of the issues, and we're going to go over here to this last question, it made me think. I have a granddaughter who is on the spectrum, and I've been blown away by how challenged my son and his wife are to find the services for my granddaughter, because there's not a lot of information about autism and how to service it, particularly if you're in underserved communities like at the African American community. And we've got to become brighter, smarter than that. We got more technology, more information than we will ever have, and we're just not living up to the stead, if you will. Dr. Daniel, they put up your chart. If you want to just explain that, and then we'll get this last question, I promise,
Okay.
and then we're going to turn it over to the next panel. Go ahead.
Okay. When I was first elected, I sat down and I thought, oh my gosh, my plate was this huge and there's all this stuff on it. And I thought, how am I ever going to figure out a way to deal with it? So I adapted this kind of a model. You can see the white concentric circle has major areas that county government works with. Public safety, jails, the judiciary, community engagement, housing, healthcare, and the infrastructure. Then the next line out are the variety of entities within those agencies and what they do. So, how do you address public safety? Well, that's the Dallas County Sheriff's Department, for example. But then that's also, they work with every one of the 26 cities and the police chiefs. So you see how it just cascades down. But it's that interconnectivity that is central to what we're talking about. And then you see then the last row is the exact entities of the RTC and what role it plays in regional transportation. And it's, to me, it at least helped organize a little bit so that my brain wasn't so overwhelmed by the need and not really having much of a handle on, okay, what's available? How do we answer these? And so this was at least a help to do
This is
that.
the ecosystem from a high level, right?
Right.
Yeah. Let's get this last question.
Good morning.
Good morning.
Oh, there we go. Good morning. Thank you so much for being here. It's a great conversation. I'm Rhonda Quintana. I'm the Chief Revenue Officer of Suresti Health, and we are a caregiver enablement dementia care program that is participating in GUIDE, which is an innovation model coming out of Medicare. GUIDE stands for Guiding and Improved Dementia Experience.
Thank
So
you.
I was very happy to hear you say that seniors are, on the top of your list in terms of things that are.
Dude, I'm a senior.
And so, so my question is, Texas has some of the highest prevalence rates of dementia in the country. And there is now a program, at least for traditional Medicare beneficiaries, to get access to care coordination, to caregiver support and education, to respite benefit, all funded by Medicare. And so is your office thinking about ways that you can connect with organizations like ours to
I would love to
take
connect with
advantage
you.
of these innovation programs? We're not the only
Absolutely.
one. There's
Because-
access.
Because, well, there is a rule number 3. Rule number 3 is kind of, if you have stopped learning, you have died. So that
Love that.
I love to talk with groups who are out there, because it's what you do. It's your boots on the ground. You know, we have a lot of our services, but then you also, and you're reaching other people. So I love to hear what's going on in that part of our community, and what are things that you're seeing, because you bring your own education, your own experience, to answer the questions that all of us have. So I would love to meet with you. Sitting at your same table is my staff person, Renee Arnold, and she can help you set up a convenient time. Thank you very much for that question.
Join me in thanking, excuse me,
Thank
the
you.
Honorable Dr.
Thank you.
Theresa Daniel,
And
County Commissioner Dallas, thank you so much. And thank all of you. Have a
Absolutely.
great day in this conversation.